So, Dr. Scholz, when it comes to hormone therapy, a patient goes on hormone therapy, at what time frame should they see a decline in the PSA, and what would be considered a good PSA if you're on hormone therapy?
So when we're talking about hormone therapy, usually we mean something like Lupron or Firmagon, and the patients will have the PSA decline about 90% in the first month. It would be a typical reaction. And then ideally, the PSA will drop down to less than 0.1 within 5 months. So there's all kinds of variations, and you can't really track it out as being the same from patient to patient. But those are sort of the thresholds and the milestones that I expect to see, about a 90% decline after a month, and then to less than 0.1 or undetectable levels within 5 months. Getting the PSA undetectable on Lupron or Firmagon or one of the other agents is one of the most powerful indicators of prognosis for prostate cancer. It's called the PSA nadir. And most men respond extremely well to hormone therapy. Their PSAs do become undetectable. The patients that can't get their PSAs to undetectable levels with Lupron have more serious types of cancer and maybe even early hormone resistance. Thank God that's not common in newly diagnosed men, but it certainly is an issue that needs to be addressed if the PSA is not going all the way down within the first 5 months or so of initiating treatment.
Is there I've heard of PSA flares or PSA bumps, Lupron flares. Can you speak to that?
So Lupron, not Firmagon, causes a brief increase in testosterone a week or two after its initial injection. Then the testosterone drops down to close to zero and remains there as long as you continue on Lupron shots. It's only for the first shot that you can have a rise in testosterone for a week or so and then a decline. And so this is how Firmagon was marketed, saying, well, we don't, with our product, have any increase in testosterone, which is undesirable. We're trying to get rid of testosterone, not increase it. You can argue that a week or two of increased testosterone doesn't have a whole lot of negative impact, but the usual policy is to give some Casodex for the first couple weeks or a month to block the testosterone during that time period. The issue becomes very important if someone is starting on Lupron who has very advanced cancer in their bones, because having a short increase in testosterone could be disastrous in those patients. For men that have localized disease, it's probably not that big an issue, but it's good practice to give a little Casodex, or maybe for the first injection, give some Firmagon, and then if you don't like the monthly injections, Firmagon can cause some problems with rashes in the tummy. You can switch over to Lupron on subsequent injections. So the flare is not so much a PSA flare, it's a testosterone flare. If you were checking the PSA every 3 or 4 days, you might be able to see a slight uptick in PSA during that first week or two, but it's really a testosterone flare.
How often should a patient be checking their PSA when they're on hormone therapy?
We usually check them after a month or two, and then every 3 months while they're on treatment. If something dynamic is happening, then we would check them more frequently, but the typical policy is about every 3 months.
Thanks for watching. If you would like more information about any of the topics we discussed today, go ahead and visit our website, PCRI.org. Also, please subscribe to our YouTube channel and give us a thumbs up. We really appreciate it.